Assalamu alaikum students. Our topic of today is adolescent health. Adolescent health is defined as the health of those aged between 10 to 19 years and youth as those between 15 to 24 years. True adolescence being the period of physical, psychological and social maturing from childhood to adulthood may fall within either age range. At present, Pakistan is known as one of the youngest countries in the world. Youth under the age of 25 constitutes 63% of the total population of Pakistan. Youth has the power to move the country into next phase of social, political and economic development. Factors which are responsible for adolescent health are late marriages, early menarche, influence of family has declined, exposure to mass media, urbanization, migration, stress, and unwanted pregnancy. More than half of the population is under 25 years. In developing countries, 4 out of 5 of the world's young population live. Adolescence is defined as the age between 10 to 19 years. Early adolescence is 10 to 13 years. Middle is 14 to 16 years. Late adolescence is defined as the age period between 17 to 19 years. Youth is defined as the age between 15 to 24 years, and young people are considered between age group 10 to 24 years. Okay, now stages of adolescence include early adolescence, which is the age period between 10 to 13 years and is characterized by a spurt of growth and the beginning of sexual maturation. Young people start to think abstractly. Mid-adolescence period is 14 to 15 years and it is characterized by main physical changes when they get completed, while the individual develops a stronger sense of identity and relates more strongly to his or her peer group. Thinking becomes more reflective. In the stage of late adolescence, the body takes its adult form, while the individual now has a distinct identity and more settled ideas and opinions. Now we will discuss that why is adolescent health important, because major physical, psychological and behavioral changes take place, sexual maturity and onset of sexual activity, development of adult mental processes and adult identity, healthy responsible parenthood, great human resource for the society, growth spurt and physical activity, menstruation and pregnancy. Around 1 in 6 persons in the world is an adolescent. There are about 1.2 billion people aged between 10 to 19 years. Most are healthy, but there is significant death, illness, and diseases among adolescents. Promotion of healthy practices during adolescence and taking steps to better protect young people from health risks are critical for its prevention. Major causes of adolescent mortality are infectious or communicable diseases and road traffic accidents. There are 49 births per thousand girls aged 15 to 19 per year globally. Half of all mental health disorders in adulthood start by age 14, but most cases are undetected and untreated. Complications linked with pregnancy and childbirth are the second cause of death for 15 to 19-year-old girls globally. Some 11% of all births worldwide are to girls aged between 15 to 19 years, and the vast majority are in lower and middle income countries. Major physical changes including skeletal growth and body composition, uh, such as weight gain, increase in adipose tissue in girls, and increased muscle mass in boys, are all of vital importance during adolescent period. Almost 25% of adult height is gained during adolescent period. Adolescent uh, stage is very crucial stage in which psychological changes also take place, which include less interest in parental activities, mood swings, intense relationship with same and opposite sex friends, increased cognition, increased need for privacy, uh, lack of impulse control, increased intellectual ability, and risk-taking behavior is very common. Sexual growth of girls and boys also take place during this time period. During adolescence, growing children must be educated regarding various aspects of living in a society and interacting with others at different levels, along with their age group. Appropriate knowledge of biological and sexual development should also be imparted. There are two kinds of needs of adolescents: their current normative needs associated with changing physical, sexual, cognitive, social, and emotional development, and their future family related needs. For adolescents' growth, nutrition is the most important factor because nearly one fifth of the adult height is gained during adolescence. About 25 to 50% of the final adult weight is gained during adolescence. 50% of bone mass is accumulated by the end of second decade of life. Nutritional requirements of the adolescents must be met because it is a rapid growth phase and they need energy for their growth and development. Most of the adult mental health disorders have their onset during their childhood or adolescence. An effective way to address is by enhancing the primary care pediatrician in the recognition, treatment, and referral of adolescents to mental health specialists. Sex education is important at all ages, but it is more important uh, during adolescent period. Sex education on self-awareness, personal relationships, human sexual development, reproduction, and sexual behavior should be given. Human sexuality is a function of the total personality, attitudes towards being a man or woman, and relationships among members of the same sex and the opposite sex. Priority health problems of adolescents include nutrition, sexual and reproductive health, maternal and child health, mental health, gender-based violence, non-communicable diseases, substance abuse, preventive health checkups, menstrual hygiene, information and counseling on sexual health issues. The major nutritional problems of adolescents include undernutrition and iron deficiency anemia, which is 22 to 91% in adolescent girls. And the reasons for iron deficiency is increased requirement for growth, menstrual loss, dislike of iron-rich foods, and frequent dieting by the adolescent girls. Other nutritional problems include obesity, which is higher in boys, and it is almost 11 to 14%. And other eating disorders include anorexia nervosa and bulimia nervosa. Reproductive problems in adolescent girls include teenage pregnancy, which is 16 to 19% of total pregnancies, and there may be genital tract infections, preterm labor, intrauterine growth retardation of babies. Abortion-related problems include unsafe abortions, and girls from problem family are at 11 times higher risk than uh, other girls. Other reproductive problems include acne, reproductive tract infections, pelvic inflammatory diseases, irregular menstrual cycles, vulvovaginitis, and urological issues. Mental health issues include suicide, manic depressive disorders, psychosis, conduct disorders, anxiety disorders, etc. Behavioral problems in adults include drug experimentation, substance abuse, tobacco use, alcohol, and illicit drug use. Risk behaviors include having knife, rods, or rash driving, violence, bullying, etc. Social factors in adolescent health include parents' perceptions, awareness, uh, school dropouts, less female literacy, economically weaker society, health-seeking behavior was neglected in adolescents, were not told whom to consult about the health problems. Approach to adolescent health include informing, educating, and sensitizing key groups in society to individual health and social development needs, advocating appropriate policy, legislation, and programs for promoting adolescent reproductive health, using innovative research to improve knowledge of factors that influence young people's sexual, contraceptive, and reproductive decisions. Primary prevention for adolescent health problems include policies, information, and education. Secondary prevention include identification and reduction of risk factors. Tertiary prevention include treatment and rehabilitation. Life skill education is a promotional program which improves positive health and self-esteem of adolescents. It provides individuals with wide alternatives in creating way of solving problems pertaining to drug use, sexual abuse, teenage pregnancy, early sexual experimentation, and bullying. Reproductive, maternal, neonatal child health, and adolescent health strategy include adolescent nutrition and iron folic acid supplementation, facility-based adolescent productive and sexual health services, information and counseling on adolescent sexual reproductive health and other health issues, menstrual hygiene, and preventive health checkups regularly. Adolescent education programs include co-curricular adolescent education and life skill education programs. They also include AIDS prevention program in which pre-service and in-service teacher training and teacher education programs are included. Inclusion of AIDS prevention education in the programs for out-of-school adolescents and young persons. They also educate about sexually transmitted diseases such as gonorrhea, syphilis, etc. incorporating measures to prevent stigma and discrimination against learners or students and educators, and life skills education into education policy for AIDS prevention. World Health Organization has evidence-based for approach to improve the quality and expand the coverage of health services for adolescents.